Malabsorption is a disorder that occurs when people are unable to absorb the nutrients from their diet such as carbohydrates, fats, minerals, proteins or vitamins. Malabsorption is a result of the disruption in at least one part of the person's digestion. Digestion actually begins when the enzymes in a person's saliva start to break down the food particles into smaller parts that the body can absorb. Enzymes continue to break down the food as it travels through the esophagus, stomach and the large and small intestines before it leaves the body as waste products. Malabsorption can occur if someone does not have enough digestive enzymes, bacteria or other foreign invaders are present, or movement in the small or large intestine is faster than usual. Some of the important conditions which can actually cause the malabsorption we are going to discuss now. Cardiovascular disorders such as congestive heart failure, constrictive pericarditis, mesenteric vascular insufficiency. Then friends, some drug-induced disorders can also cause malabsorption such as cholestyramine, colchicine, irritant laxatives and neomycin. Impaired digestion. Gastric surgery such as gastric bypass or weight loss surgeries, gastrinoma, inadequate absorptive surface in conditions such as jejunal bypass, short bowel syndrome. Certain infections such as acute infectious enteritis, parasitic infections such as Giardia lamblia or helminthiasis, tropical sprue and Whipple's disease too. Intestinal mucosal abnormalities such as amyloidosis, cystinuria, Crohn's disease, eosinophilic enteritis, non-tropical sprue. And also lymphatic obstructions such as intestinal lymphoma, lymphangiectasia and tuberculosis. Apart from that, reduced bile salt concentration can also cause malabsorption in conditions such as bacterial overgrowth from the small intestine, ileal dissection or disease and liver diseases. Now, some types of malabsorption syndromes do not actually fall under any kind of the category. These include conditions such as diabetes mellitus, carcinoid syndrome and mastocytosis. Now, let's discuss the symptoms associated with malabsorption. Gas and diarrhea are the potential symptoms of malabsorption. Example of some immediate malabsorption symptoms that may occur are such as bloating and stomach distension, diarrhea, fatigue, feeling of gaseousness, statuary or stool that is pale to white floats on the pot, stools that appear greasy in the texture with stomach cramps and weakness. People need nutrients from food to maintain the healthy body. When the body cannot properly absorb these nutrients, they might actually experience the more long-term effects of malabsorption. These include bone pain, bones that fracture very easily, iron deficiency anemia which can result in shortness of the breath, muscle wasting, a sore tongue and weight loss. People should seek immediate medical attention if they absorb blood in the stool. Sometimes this blood may look like dried coffee grounds or are coughing up the blood. Now, signs people should seek advice of the doctor include like fatigue, continued abdominal bloating, frequent diarrhea, sore tongue, weakness, weight loss. Now let us come to the diagnosis. Your doctor might ask about when a person first noticed the symptoms, what makes these symptoms worse or better, and what types of medical conditions a person actually already have. Based on this, one might need a variety of the tests to rule out or confirm the diagnosis. These tests include blood tests first. Doctors may request full blood counts, that is complete blood count, as well as electrolyte balances. Checking protein levels in the blood may also help to understand whether someone is having malnourishment and to what degree. Then stool test. Stool test might be done to test for the presence of excess fat in the stool. High levels of fat might mean that the person is not absorbing the fat in the diet very well. Then breath test. Breath test is done to check for the presence of hydrogen gas in those who may be having the lactose intolerance. The intestines will produce excess of the hydrogen gas if they cannot actually absorb the lactose correctly. Then imaging tests. Certain imaging studies such as X-ray, ultrasound and CT abdomen might be needed to check the structure of the digestive organs. One can also be advised for upper GI endoscopy or colonoscopy to examine the intestinal lining and take tissue biopsies to diagnose certain conditions. Now, what are the treatment options? A nutritionist or a dietitian can create a diet plan for someone with malabsorption. Initially, one can avoid the food type that is causing the malabsorption, such as lactose or gluten containing foods. The physician can evaluate the nutrients present in this food type and make the recommendations on supplementation as a means of enhancing nutritional intake. Now, certain complications complications might happen. Malabsorption can lead to weight loss, malnutrition, and even failure to thrive in many people. A person can also experience impaired wound healing, a deficient immune system, and low energy levels. Anyone who notices their symptoms become more frequent and less occasional should seek medical advice. This way, they can receive treatment before they experience significant unwanted weight loss and other side effects. So one should be concerned about the malabsorption symptoms and seek the medical advice as soon as possible. Thanks friends for watching this video.